Okay, hi, I'm Sierra Wondersea, and my PowerPoint is over high tibial osteotomy and unicompartmental knee arthroplasty and rates of return to sports and work. And the picture that is on my title slide is actually a picture of my knee from whenever I had osteotomy surgery. So what does high tibial osteotomy consist of? High tibial osteotomy is a surgical procedure that realigns the knee joint. For some patients who have knee arthritis, this surgery can delay or prevent the need for a partial or total knee replacement by preserving damaged joint tissue. A high tibial osteotomy can realign the knee to take pressure off of the damaged side by wedging open the upper portion of the tibia to reconfigure the knee joint. Weight bearing is then shifted away from the damaged or worn tissue and onto the healthier tissue. This type of osteotomy is generally considered to be a way to prolong the time before a knee replacement is necessary. This procedure is typically reserved for younger patients with pain resulting from instability and malalignment. So going back to the first picture, my 8th grade year, I actually had tibial osteotomy surgery because my kneecap kept popping out of place. So along like a high tibial osteotomy, they had to go in, break my tibia, move it to where it's curved instead of straight up. That way, like my kneecap can't pop out because my bone is curved around it. So that prevents it from popping out. And then they had to put screws in, just like in this X-ray, because you're gonna have the more like your bone's gonna have to form around the screws. And then I ended up getting my screws taken out because they stuck out. Um, but yeah, so just like this, like my knee, it's less invasive kinda, but my knee is at a curve now rather than just like a straight bone like everybody else's. And then for the unicompartmental knee arthroplasty, that's also known as UKA, this is known as a partial knee replacement instead of a full. It's a surgical procedure that treats osteoarthritis in one compartment of the knee rather than the whole or multiple areas of the knee. Only a portion of the knee is resurfaced, so this procedure is an alternative to total knee replacement for patients whose disease is limited to just one area of the knee instead of your whole entire knee. Because a partial knee replacement is done through a smaller incision, patients usually spend less time in the hospital and return to normal activities sooner than a total knee replacement would. In knee osteoarthritis, the cartilage protecting the bones of the knee is slowly wears away. So this can occur throughout the knee joint or just in a single area of the knee. Um, so because I had osteotomy surgery, I now have osteoarthritis. So they told me that at some point I'm gonna have to get either a partial knee replacement or a full knee replacement. So this is really interesting to me. And as you can see in the picture that's on the slide, for the total, you can see that they put hardware like over your whole entire knee. And then for the UKA, they only put it in like the spot that's needed. So if I wanted to make like an experiment or whatever, and like for me, for example, when it says patient questions and concern, like my main thing was how long is it going to be until I can return back to playing volleyball? Um, and I feel like for a lot of people, like their main question is when can I go back to work and when can I go back to sports? And when or if I do, am I going to be 100% or am I not going to be like 100% and stuff like that. So the good thing going along with these two surgeries is so you can see in the graphs, the figure on the left shows the percentage rate of returning to sports based off of two different sources. And then from the one source, it says that 82% of people return to sports. And then from another source, it said that 90% people who have high tibial osteotomy return to sports. So that's like a really high like positivity rate. So this is like a surgery that I mean you can get and then you're like 99.9% like you're going to return to your sports. And then on the right side that talks about the unicompartmental knee arthroplasty or UKA, this shows the percentage rate of returning to work after this surgery. And one source said that there was an 80.8% chance of people returning, and another source said that there was a 93% chance of people returning to work. So once again, after you have UKA, like there's a very, very high positivity rate that you're going to return to work, which I think is very important because I know some people are like scared that if they have the surgery that they won't be able to go back to sports or work. And these two are good surgeries because like you're going to return. Um, And then while the positivity outcome rate is high, there is much more research and studying that needs to be thoroughly careful and examined, which is obvious. The subject that needs addressed the most is a more exact time frame of returning to sports and or work. Just because the positivity rate is great, this does not mean that patients, it doesn't give them a goal or a time post-operatively. Because, I mean, you can say like it's going to take 3 months, but that's not always the case. So I feel like we need to like come up with a way where we can like figure out like exactly how long it's going to be before you can return back to work in sports. Most of these patients are either workers or athletes whose jobs require high demanding activities. Their levels of pain need to be reduced and activity increased in an acceptable time frame, because nobody wants to go back to sports or work if you're in pain, because that's just not comfortable and you just don't want to be there. So I want to come up with something that makes like to be reduced, because like since I was a patient that had osteotomy surgery, I was in a great amount of pain, and like now I wish like I want to help other people to see, oh, like what can reduce their pain, because I know how bad mine was. And I feel like that's just really important for any kind of surgery, but especially this one, since I've been on the patient side and know how it is. So I kind of want to give them something that'll make it a little better. And then for my questions, I have like if you came to your preoperative appointment, I'll give you a questionnaire, and one's going to be like, I made it into one, but it's going to be for athletes and workers, and it's going to ask you like what sports and occupations are you involved in, what's your pain level right now, like 0 to 10, 10 being the worst. um what limitations like do you have like prior to surgery, like can you not play, or if you play, like does it hurt, like can you go up and down stairs, just like stuff like that. And then like I want to know how long you've been having this pain, because I feel like if it's like a new pain, then like there's probably something that like happened real quick that's wrong. But if it's like over a time frame, then it's probably just like degenerative kind of. So kind of just like arthritis, like where you get it at first and then you kind of just like get used to it, but you still shouldn't be used to that. And then for post-op, it's going to be another questionnaire, and it's kind of going to be the same thing. But for post-op, I want to know like, have you returned to sports and occupations? What's your pain level now after surgery, if you have any? What limitations you have post-operatively. So like if after you have surgery, like if you still like struggle going up and down stairs, or it still hurts when you play like that after like you've recovered, then I feel like something's probably not 100% right. Um, so I want to know that, obviously. And then the time frame of post-operative complications. So like after you're released, like has it been hurting since the day you're like you just went back, or has it been hurting the whole time like you've been back? Because obviously something's not right there either. And then for my research question, it's going to be what precise time frame can these patients expect in returning to sports and or work? And my hypothesis is going to be like the time frame or goal for returning to sports at 4 months and work at 3 months. And then my independent variable is going to be activity before surgery, and my dependent is going to be time frame to return. And then for my goals, like number one, like present informative questionnaires for preoperative appointments, which I already showed you. And then number two, obtain data that will help justify a plan for after surgery while at preoperative appointments. Because just because like somebody, like say I get the same surgery and somebody else gets the same surgery, like post-operatively, like we're going to recover differently because not everybody's the same. Like there's going to be things that I can do better or somebody else could do better than me after the same surgery. So since everybody's different, it's kind of hard to figure out like one specific thing, because not everybody's the same after they have surgery. So I kind of just like want to get like a bunch of data, like to see like what's better for people. Or like if everybody is different and something works better than for somebody than like somebody else, then like I would just want like different ways that I can help each person. Um, and then three, present my study and prove why this needs to be addressed and why the funds are important, because I've been through the tibial osteotomy surgery, and I'll sooner or later have to have the partial total knee arthroplasty. And when I was in 8th grade, this surgery wasn't easy at all. I went in thinking I was going to have a 3-month recovery, and I ended up having over a year-month recovery because of complications that I had. and I ended up breaking my knee again after I had surgery, so I got set back again. I had to learn how to walk again, jump again, run. It took me 3.5 months to learn how to go up and down stairs again. So I just feel like me being on the patient side, it's like really like I'm just very strong about this because I know what it feels like, and I don't want anybody like to feel like that, and I don't want anybody like to be set back from 3 months to a year. Um, so I just want to find something that'll help because I mean, present and prove. Like I just want, like I've gone through it, so I just want people to have the best like possible scenario they can if they have one of these two surgeries. And then types of data collected, I'm going to collect answers concerning preoperative activity pain, such as like activity levels and the inflammation that patients have. And then answers concerning postoperative issues, such as worse pain or particular issues holding them from improving. And then I'm going to have like stats on goals met and achievability. And then for my methods, the questionnaire is going to be like the ones I showed you in the slides before that asked about like what sports and occupation the patient's involved in, pain level, limitations, and time frame of complications before and after, because I want to know like if you have surgery and stuff. And these are going to be like or athletes and work, like those are going to be like two different kind of things, because like if you think about it, depending on like what kind of job you have, but if you play sports like basketball, and like I played volleyball, so I was like diving on the floor a lot, and I was like doing like pivots and stuff like that, and I know with basketball like you do that too, and like even just like with running, like those are going to be completely different than going back to work, because like not a lot of jobs, like you don't really run a lot, mostly jobs are like picking stuff up and stuff like that. So they're going to have like weight restrictions and like things like that. Like, I mean, if you go to work and you sit at a desk, then obviously you're going to be able to return sooner than somebody who has to um, like if you work at like a lumber place or whatever and you're picking stuff up and you're always moving stuff, and that's going to be different than somebody that works at a desk job. And then athletes, obviously, if you're diving on the floor, like that's way different. So, obviously, like I'm gonna like have a more studied or focused study on workers and athletes like prior to and after surgery, and they're gonna have like different because then like you're gonna have therapy too and stuff like that, and so athletes and workers are different, but it's still activities, so I just want to get them back to doing like what they need to do or what they like doing. So I think that's very important. And then for the rationale, this is a picture of a high tibial osteotomy surgery. Um, and these procedures and their goals concerning a turnaround for time for athletes and workers is very important for those patients, so they're able to plan ahead of time for postoperative. Because like say, like you have a goal, like whatever month, whatever day, like you have tryouts for something. Obviously you want to get like kind of back to 100% before that. So, like I want them to be able to plan ahead of time and like kind of have a goal for themselves. So I think like that's important to where I want to figure out like how long it's going to take them and when they can get back to doing what they love. So they can plan ahead of time instead of like getting disappointed if they aren't um, healthy at 3 months. Like if you're like you can tell them 3 months, but if they're not healthy at 3 months, then I feel like they kind of feel like they did something wrong, because that's how I felt, but that's not always true. So I just want to, plan ahead of time and figure out how long it's going to take so they can reach their goals. And then for my summary, a high tibial osteotomy and unicompartmental knee arthroplasty are great alternatives to a complete knee replacement, because like I said, a whole knee replacement is going to take out your whole entire knee, whereas the UKA just takes out a spot. And then an osteotomy, you're going to do that before you do either one of the two surgeries, because you're going to try and get that like to see if it'll help you before you have to get a partial knee replacement, because obviously that's kind of a big deal. Like whenever you think of a knee replacement, you're like, whoa, like that's crazy. Like that's kind of very invasive. So obviously you want to get a osteotomy surgery before you get an arthroplasty. So, and I think that they deserve more attention when it comes to answers to return to sports and work. And if these issues are addressed at preoperative appointments, it will make postoperative recovery more or less stressful and more focused because you're going to know what to talk about and stuff like that. And there's nothing more that I would like to do than to help these patients achieve their personal goals, just like my doctors and family helped me achieve mine. And with your help, I can make that possible, just like my doctors and everybody made that possible for me. And then these are my works cited page, and my works cited page continued. And then here are my images. So, thank you for listening, and I hope that you got something out of this, because it's obviously very important for me because I've been on the patient side. So, but all right, and that's all I have. Thank you.